Hi everybody, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates.
My name is Rhys, Barber. I'm the other audiologist here at Audiology Associates. This is actually my patient today. Quite an interesting little case, this one. At first glance, it looks like there's cerumen, it looks like there's wax in there, but when you get a grip on it with a suction tube, you can see this whole layer at the front here just pushing back against the suction tube, and we just can't get a grip on here. Now that's because this is desquamated keratin. So when we talk about desquamation, if you ever hear the term, it just means that it's sort of detached, it's come away. So I think it comes from the Latin for, I think it's descaling a fish. I think that's where it comes from. But basically it just means it's come away. So if you ever hear the term, that's what it means.
We're descaling fish.
We're descaling fish, it's the ear canal, there you go. So we've got the 8-bar hook in here, just pulling this keratin layer here from the very outermost portions. We're in the cartilaginous portion of the ear canal here. I actually dropped that piece on the patient by accident. It kind of fell off. I forgot to tell the patients about when they left, so they have a nice surprise when they go home then.
Oh, lovely.
But this is coming away actually quite well. The reason I opted to use the 8-bar hook rather than microsuction at this point, at the start, sorry, was just because I couldn't get the grip. It just wasn't holding on to that keratin particularly well.
Like plates, like, yeah.
Yeah.
Just very, very tricky to get the angle sometimes.
Oh, really. And the surface is so tough. So imagine, remember keratin is what your hair and nails are made out of. So if you touch your nail, you can get this, that's the kind of feeling you're going to get on these things. I know everyone's going to be doing that. But it's really tough old stuff, and it doesn't want to come away very, very well. I don't think we're looking at keratosis for a couple of different reasons. The first of all, the patient has had an ear, nose and throat history. So they did have, they were a little bit fuzzy on what they had, but they had an operation now where they said they had to remove something from the ear canal. They did say they thought it was a benign tumour from the canal. So that would account for why we're seeing what we're seeing here, because if we talk about that epithelial migration, so epithelial skin cells, okay, epithelial skin cells. So basically, as that migrates off, you got a really good description because it starts in the center of the tympanic membrane. You come up with a really good way of describing that, which is a lot better than I can do.
I've mentioned it a while ago, but if you can just kind of imagine like a really calm lake, and you throw a little pebble in, and you get those ripples that just kind of, well, just get wider and wider and wider, and that's pretty much what the skin should do inside the ear. So it'll grow from the sort of umbo, the center of the tympanic membrane, the eardrum, and it'll just try and grow outwards and then down the ear canal, and that's naturally what should be happening to everyone's ears. It's trying to migrate, it's trying to push the wax out naturally, but it doesn't always happen, and it just kind of builds up and forms layers, and here we are.
With the surgery that this lady's had, if you imagine any scar tissue, imagine scar tissue anywhere else in your body, you're going to get that epithelial migration is going to hit that scar tissue and get interrupted. And then as those epithelial cells detach, as they become desquamated, then what you get is they start to fill with keratin, so they start to harden. That's what we're seeing here. Look at this plug coming away here. Now, that's one of the reasons I don't think this is keratosis obturans. The other is patient didn't report any pain, nothing at all, and that's a really good classic sign of keratosis obturans. And there's no peripheral matrix around this keratin plug. It is not quite lamellae either. You haven't got those layers in there, have you? It's more sort of higgledy-piggledy, if you like, all kind of compressed in there. But it's coming away really, really well. We're down now, we're into that osseous portion of the ear canal now. Now everything's going really smoothly so far, touch wood. So it's coming away really, really nicely. But past this point now, you'll see it changes a little bit at this point. So when we get into that, we're into the osseous portion already, but when we get into these deeper sections, you'll see what I mean now about how the keratin plug changes slightly. So we're just going to lift up. I know, yeah. What I've noticed is that we do have sort of quite a pronounced anterior recess here. So what you'll see in a second is we've got this quite pronounced bow in the ear canal. You can see that layer, see that ripple effect at the top there, and that's that sort of desquamated epithelial cells. They almost sort of concertina, so you get this kind of wave, this ripple effect running through them, and that's how we know that they're epithelial layers or keratin layers as well will have it sometimes.
Cool, that's a good one.
That's a nice one coming away. St. Bart's hook's done really well to get this one out. It's a good little tool for these harder pieces. I think Rose and Inserter might have worked quite well.
Yeah, I've used the St. Bart's hook quite a bit recently, actually.
Yeah.
I've been using them a bit more, to be fair.
Yeah. There you
It's
go.
a nice piece.
Another piece of keratin coming away. So you can see it was quite a bit in here. Now it's been a good few years since this patient has had their ear canals cleared. Now you can see that ridge there, just the left-hand side. You can just see the canal bowing here. Now it looks like keratin, but that's actually part of the canal. You'll see now as we move. I'm trying to just roll or peel this downwards. So I've got a leading edge there. If you look just above, you'll see a dry epithelial layer. This is sort of just pulling and flexing. See it there?
Oh, yeah.
There you go. So that dry epithelial layer. Now the patient did sort of jump a little bit at that point because as we said in one of the videos this week, we're in the osseous portion of the canal. Os means bone. So you're in the bony portion of the ear canal. Skin on bone at this point. No real give there. So it's ultra sensitive. Now you will see the
really slow with these ones.
That's exactly right. Just gentle. Yeah, trying to get a grip. You can see where it slopes upwards, that sort of keratin sloping, and you'll see the edge here. Now we are starting to see that's matrix there, so we could be looking at possibly a precursor now, or very early stages of keratosis obturans on this one, because we have got the matrix at this point, but before that, nothing there at all. So I think the first lot of keratin we took through was more interruption to epithelial migration. Yeah. I think this is more leaning towards that keratosis obturans now.
Here it comes.
Look at that. You can really see, look at that under there. If we take a look at this, the eardrum's not going to look pretty because obviously the patient has had some surgery. There you go. You can really see. So at this point, you're thinking, well, okay, are we looking at this just being sort of, the anterior recess, or are we looking at this possibly a little bit of bone remodeling there in that osseous portion of the canal? I think it's probably more likely due to the surgery, looking at what the eardrum looked like there. But yeah, that's a hole, isn't it? Look at that. So we're what, 1 inch and 3/8? I would say that one.
3.25 centimeters, 3.5 centimeters.
3.5, I reckon. 3.5 too. That's 3.5 centimeters.
It's coming glasses on.
So, guys, I hope you enjoyed that as much as we do. Please don't forget, if you are enjoying more of the medical terminology thrown in, let us know. We will keep doing that for you because this channel is very much led by what you guys want to watch. If you do have any problems with your ears, by all means, check out the link tree in the description. It takes you through to any bit you want to know about us, as far as our website, social media channels, anything you want to know about us is all on there. And obviously, if you do have any problems, contact us through there. And we shall see you again on Monday. We'll see how many videos we put up next week, depends how much time we get together. But as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another, and myself, and the splendiferously lovely Mr. Taylor Green.
Stop it.
I'll see you on Monday. As always, guys, bye.
Bye.